Hello, my name is Arya Javidan, and I'm the project manager for the National Consortium of Telehealth Resource Centers. Welcome to today's webinar, Facilitating Use of Telehealth for Metabolic Dietitians. Today's webinar is hosted by the Pacific Basin Telehealth Resource Center, and these sessions are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. Just a few housekeeping tips before we get started today. Your audio has been muted. Please use the Q&A function of the Zoom platform to ask questions. Questions will be answered at the end of the presentation. Please only use the chat for communicating issues with technology or communication access issues. Please refrain using chat to ask questions or make comments. Please note that closed captioning is also available, and that is located at the bottom of your screen. Today's webinar is also being recorded, and you will be able to access today's and past webinars on the NCTRC YouTube channel and the NCTRC website at telehealthresourcecenter.org. And with that, I will pass it over to Sylvia Mann, co-director for the Pacific Basin Telehealth Resource Center.
Aloha, everybody. I'm so happy that we are doing this webinar for metabolic dietitians. I think next slide. Oh, yeah. Okay, so I'm just going to give you an overview of what we're going to do during this webinar. Um, there's a lot of information packed in this webinar, and we are hopeful that we will continue with a series of webinars for metabolic dietitians because you have so many questions. So we're going to do an introduction. What are the telehealth resource centers? Review of the questions that have been asked, general telehealth policies, general coverage and reimbursement, give you some telehealth resources, and talk about some future activities. Next slide. So I guess you're wondering who I am. I know some of you. I have known Ronnie Singh for decades. We have been co-workers, colleagues, and friends for a long, long time. So I am a board certified genetic counselor. I have supervised the Hawaii newborn metabolic screening program for 25 years. I was also project director of one of the regional genetics networks. You might know Ronnie was co-director of the Southwest Regional Genetics Network, Southeast Regional Genetics Network, sorry. I was project director of the Western States Regional Genetics Network for 20 years. I've worked with many metabolic dietitians throughout my 30-year career and know how valuable metabolic dietitians are and now getting how rare they are. Um, I developed a telegenetics training program for genetics providers as part of our Western States activities, and that went across the country. So we ended up training genetics providers across the country. During the pandemic, I was asked to convert the telegenetics training to regular healthcare provider training. And we also were asked to develop educational resources for families to do telehealth in their homes. Prior to the pandemic, it was very rare for families to get telehealth in their homes, mainly because providers were not reimbursed for those services. But the pandemic really drove the fact that we needed the families stay in their homes so that we need to do telehealth for them. But there was very little education about how that was going to happen. And now I've retired from the health department, but I am currently appointed at the University of Hawaii as co-director of the Pacific Basin Telehealth Resource Center. And I'm really happy to be in this new part of my life helping people with telehealth because it's so rewarding. Next slide. So I'm sure that many of you know why telehealth is important, but I did want to go through some of the reasons why we decided we wanted to focus on metabolic dietitians. So we want to make sure that the families that were detected through newborn screening or the other families you work with could have more flexibility and accessibility, especially those living in rural areas, especially since we're finding that metabolic dietitians are getting rarer for that specialty. It allows more continuous care when families can't travel to in-person appointments easily. This is the same for families that have chronic disease. It just allows that little extra continuous care to keep them as healthy as possible. It can provide more information to the dietitian when families are seen in their home Many practitioners tell me it's really good to be able to see the families in their homes. Some of them even get tours of refrigerators and cupboards and what they're storing in there and what they're eating. So it makes it really good for them to be able to be in the family's home. Also, it's stressful for families to come into a medical center or clinic. And so families that don't have to travel are less stressed. It costs them less because they don't have to drive, they don't have to pay for parking, don't have to look for parking. And so it can be more natural in their home setting and maybe more relaxed for your appointment. Also, the final thing, which is just coincidental, is that working with dietitians, nutrition, medically necessary services, and children aligns well with activities in the Make America Healthy Again plan. So, if there's more funding available, more resources available through the new federal government programs, we want to make sure that we pass that on to the metabolic dietitians that can use that information and maybe get more funding or more support for their services. Next slide. And now Arya is going to go over a very big resource for you, the HRSA-funded Telehealth Resource Centers. HRSA is Health Resources and Services Administration, which is the federal government. And Pacific Basin is just one of the telehealth resource centers. But Arya is going to tell you about the help that you can get in your area.
Thanks, Sylvia. Just to provide a little bit of background, the National Consortium of Telehealth Resource Centers, or NCTRC for short, it is a collaborative of the 12 regional and 2 national telehealth resource centers. We're committed to implementing telehealth programs for rural and underserved communities, funded by the U.S. Department of Health and Human Services, Health Resources and Services Administration, through a cooperative agreement for the Office for the Advancement of Telehealth. The first group of TRCs were funded in 2006, and for the last 19 years now, the program has grown and expanded across the nation. In 2017, the 14 TRCs began working collaboratively under the consortium, and today the 12 regional centers combine to cover all 50 states, the District of Columbia, the affiliated Pacific Islands, Puerto Rico, and the U.S. Virgin Islands. The remaining 2 centers have a national focus, with the Center for Connected Health Policy focusing on telehealth policy, and the Telehealth Technology Assessment Resource Center, TTAC, focusing on telehealth technology. TRCs across the nation provide timely information on telehealth. The consortium provides unbiased, nonpartisan, and expert telehealth technical assistance to various healthcare organizations, networks, physicians, and others throughout the country with a particular emphasis on rural and medically underserved areas. The regional TRCs specifically are experts in telehealth implementation, and they have a region, each TRC has a regional uniqueness, allowing them to provide a wide range of assistance targeting local community needs. The consortium website, telehealthresourcecenter.org, acts as a clearinghouse for TRC curated resources, including fact sheets, toolkits, reports, webinars. We also have translated resources where we've compiled resources from various TRCs in 13 different languages. There is a central contact us page where you can submit your request for technical assistance. There is also an interactive map where users can easily locate and contact their regional TRC depending on their location. The experts page features TRC staff with different areas of expertise depending on your need, including fields such as operations, clinical services, education, licensure, and remote patient monitoring, to name a few. I want to take a few minutes to point out some resources by the 2 national TRCs. So TTAC, the Telehealth Technology Assessment Resource Center, houses several technology toolkits on their website, including a clinician's guide to video platforms, direct to consumer, and a technology assessment 101. These toolkits allow users to learn the fundamentals of how various technologies work, as well as how to assess them for use in telehealth programs. For Innovation Watch, TTAC has compiled several resources revolving around innovation, technology, and broadband in the field of telehealth. These sample new product development that can help expand the realm of telemedicine, as well as other innovative products and items that impact healthcare. And for each product, TTAC takes a closer look at what it can accomplish and the impact it has on telehealth. And then finally, TTAC recently released a quick start guide launching a solo telenutrition practice. This guide outlines a step-by-step approach to setting up a solo telenutrition practice with practical considerations for technology selection, workflow design, and patient engagement. and it's designed to help launch efficiently while avoiding common pitfalls. That includes defining services and delivery models, configuring scheduling, billing, and preparing for a soft launch and long-term optimization of your practice. CCHP, the National Telehealth Policy Resource Center, has several policy resources available. They have a policy finder tool on their website, which tracks and compiles telehealth-related laws and regulations across all 50 states, the District of Columbia, as well as at the federal level. A few special features of the policy finder are the ability to compare the policy of any of the selected topic areas, such as Medicare, Medicaid, private payer, professional requirements for any two states. The Policy Finder database is updated consistently throughout the year, but they do also publish their state telehealth laws and reimbursement policies report with the latest update released in fall 2024. CCHP also produced a fact sheet that reviews the telehealth-related items that the Centers for Medicare and Medicaid Services has proposed for the calendar year 2026 in the physician fee schedule. CCHP also recently released an updated telehealth billing guide. They do that every year to clarify telehealth billing and reimbursement, current legislation dictating billing requirements. The last update was fall 2024. And then lastly, they created a Telehealth 201 series of short explainer videos that provide a deeper understanding on telehealth policy in fields such as telehealth coverage, licensure, prescribing, and HIPAA and privacy. I really just provided a sampling of the TRC resources and services available. There are many more resources available on our website, as well as individual TRC websites. We also have a skills matrix available on our website, which lists skill areas and clinical telehealth specialties each TRC has if you're looking for a specific area of expertise. And here I've just included contact information and direct website links for all 12 regional TRCs, as well as the 2 national ones for reference. There is an interactive map and centers page on our website that lists all this information as well. And that is available at telehealthresourcecenter.org. And with that, I will pass it back to Sylvia.
Thank you, Aria. So I guess many of you probably didn't know that telehealth resource centers existed. So hopefully this will help you in the future. There's lots of wonderful people just waiting to answer your questions and give you technical assistance for free. And again, this is we are funded by HRSA. So this is federally funded, and we would love to help anybody that needs assistance with their telehealth practice. Next slide, Aria. So, many people submitted questions. And so what I did is put them into the categories of questions. And as I said, each one of these issues could take an entire hour-long webinar or more. So need help setting up a telehealth program. I want to know about coverage and reimbursement issues. I want to know about seeing patients across state borders. I want to know best practices for using telehealth. And I want to know what others are doing with telehealth. Next slide, Aria. So, for those of you who are looking to set up telehealth practice, besides the help from the Telehealth Resource Centers and the videos and all the other ones, you're in luck. Our Southwest Telehealth Resource Center is doing a training on how to set up a telemedicine program. And that is happening September 9th. It is free. The registration link is at the bottom of this slide, and you can participate in that. They're going to talk all about how to set up a telemedicine program. And these type of webinars happen throughout the year from different TRCs on different topics about running a telemedicine program on different topics of running a telehealth program. Next slide, Aria. So I'm going to go over general telehealth policies. What I'm going to try to do is give you a 10,000-foot level kind of look at things that are happening, things that you need to consider, just practical information. As Aria showed you, there is so much information and so many resources for you. But we're hoping that in the future, what we're going to do is really hold additional webinars that are just focused on your practice so that we can help you work through the different issues that you're asking questions about. But for this webinar, to keep within the time limit, I am going to just go over some of the general things that you might want to start thinking about. Next slide. So as Arya said, we have the Center for Connected Health Policy. I like to teach people to fish instead of giving them fish. So what I'm going to try to give you is our tools to be able to find out things yourself. So this telehealth policy finder is really great when you want to figure out what's going on in my state or what's going on in the state that I want to see patients in. This telehealth finder on CCHP is really up to date, so you can see what's going on and it helps you locate telehealth laws. Um, One of the things I noticed is that it focuses a lot on doctors and nurses. So for dietitians and for my practice, genetic counseling, I usually use it to find the relevant laws, and then I go into the state law, and then I look for my profession. So next slide, Aria. So the other thing is that to look for specific legislation in your state that might concern your actual profession, you can go to each state legislature website, and they usually have a search function, and you can search on what bills have been introduced to look to become law, what laws have been passed. And I do this well, I used to do this. I don't do it anymore since I don't work for the health department. But I used to do this every year. I had a list of keywords. I would go in and search what proposed bills were being heard to enact into law for genetics, newborn screening, telehealth. So I had a whole list of words. But it's a very useful function for the New Jersey, the state legislature websites. Next slide. So one of the questions is practicing across state borders. So the distance site, again, if people have not done telehealth, is where you are practicing. The originating site is where your patient is located. So the law, both your licensure law and any telehealth laws that are related to doing telehealth, applies where your patient is. So if you're in California and your patient is in Oregon, then you have to follow the Oregon laws for doing telehealth and for your licensure. So I think that dietitians and genetic counselors are not licensed in all 50 states and territories. So if a state does not have licensure for your profession, then there isn't anything to follow in that state, basically. So that's one of the things that's a little strange because your state could have very strict licensure laws, and then you're gonna do telehealth to another state, patients in other states, and they don't have any licensure. So there's no licensure law to follow. So it's a little bit strange in this telehealth world that that can happen because in-person visits, you're there in the state seeing the patient, so you have to follow the law in that state. Some states, however, have, I call them snowbird telehealth laws because I know this is why it came up. In Florida, for those of you who don't know, a lot of people go to Florida when it's winter where they are, especially people in New York, go to Florida and they're called snowbirds because whenever it gets cold, they go down to warmer climates. So those states that, like Florida, have passed laws to help those people that are snowbirds still be able to see their healthcare professionals in the state that they come from. And so, like in Florida, if you have an active license in another state or the District of Columbia, you can register as a telehealth provider in Florida. You don't have to get a Florida license. You just have to register as a telehealth provider, and you can continue to provide telehealth services to your existing patients, even if you're not licensed in Florida. So there are these interesting snowbird laws in some states. Next slide. So, dietitians, I found interesting. You have certain states that license you, certain states that register you, and certain states that certify you. So I went into a deep dive into, wow, I thought genetic counseling licensure was complicated. Your dietitian licensing and registration certification is more complicated than what we have. So, for example, in Utah, there is dietitian certification. And so it lays out what you need to be certified. So if you're a dietitian in California and you're going to see patients by telehealth in Utah, you will need to be certified based on this law that they have in Utah. Next slide, Aria. And so also there's practice protection, which is what the law says that dietitians are allowed to do. And there is name protection. So name protection says you can't call yourself a certified dietitian, registered, whatever, unless you are certified in that state. So so that is very important too. So you can't even, if you're not certified in Utah, you can't go to Utah and call yourself a certified dietitian because you might be certified or registered or licensed in the state that you come from. But under Utah law, you are not allowed to use those titles unless you're certified by Utah. So that is pretty much how it is for each state that has this type of law is they usually have practice protection, so that's doing the work, and name protection, that's what you call yourself, so that that protects that person's profession in that state. Next slide. So I'm going to go over some interesting state laws for telehealth activities. Now, one of the things with telehealth statutes is that sometimes states make overall telehealth law. So there's a standalone law that applies to anybody doing telehealth in their state. Some states go to the level where they have pretty boilerplate language for telehealth and they insert it into every licensed health professional statute. So in New Jersey, unfortunately, they're in the midst of redoing the dietitian wording right now, is what I understand. But if you're a doctor, genetic counselor, you're a dentist, you're a social worker, you're OT, PT, they insert the same language in there about telehealth. So in each licensure statute, they put in language about doing telehealth. So that when you look at statutes, you have to search for overall statutes and you have to search within your licensure, certification, registration statute about whether there's telehealth language in there. Next slide. So this is an example of a standalone overarching telehealth statute. In Washington State, and I think this is the only state that I've come across, they actually require telehealth training. So they have a requirement for healthcare providers to do telehealth training. When the law first passed, it was every healthcare provider. And I think that was in 2021. But I noticed that the next year, the doctors' lobbying group must have gotten in there because then doctors were removed from needing to have telehealth training. So it's like every other healthcare professional that does telehealth needs to have training, but not the doctors. So Washington has this overarching law that everybody needs training. And that they have this group that will develop training, or you can have, if you can prove that you have training through another source, then that can qualify too. Next slide. Next slide. This is the whole law. I just put it in so you can look at it if you want to. So New Jersey, telehealth registration. Anybody doing telehealth needs to register with the state organization, whether you're a distance site, originating site, or both, you have to register with the state of New Jersey. So this is a standalone law. Next slide. Also, I showed the genetic counselor wording because this is in every healthcare professional, and this will be in the dietitian one once they finish messing with the wording and make it official again. So one of the interesting things is that when you do telehealth, you have to provide your name, your professional credentials. And I'm not sure how that's done, whether you have to show your certification diploma or whatever, or I don't know how you show your professional credentials, and your contact information to the patient. But that contact information has to allow them to contact that licensed genetic counselor. Now, if this was the physician statute, it would say licensed physician, if you're a dentist, licensed dentist. But they have to be able to contact you for at least 72 hours following the provision of your service. Or longer if the circumstances warrant that. Now, that's interesting to me because I think to myself, what if you saw a patient, then you went on vacation? Like, how would you give them contact information for you? Would it be someone to cover for you? But this is New Jersey decided that this is something that they want to make sure that anyone does telehealth, the patient can contact you for 72 hours after your session. Next slide. So another one from Utah is that when you do telehealth, you have to be familiar with the emergency resources near the originating site. That means where your patients are. So if something happens, you can't dial 911 where you are. You have to know how to dial emergency services where your patient is before you do the telehealth appointment so that you can make the appropriate referrals when it's indicated. So that is another thing that Utah requires that I haven't seen in many telehealth statutes, but someone who's doing telehealth to a patient in Utah will need to know the emergency contact information where the patient is. Next slide. Other professional issues. Next slide. Okay, so we have the legal issues. Liability malpractice coverage. If you practice across state borders, please check your liability malpractice coverage because sometimes your liability malpractice only covers you in your own home state or only in certain states because not all malpractice providers have coverage in every state. So you have to check that to make sure that you're covered in the state that you're doing your telehealth services to if you're doing cross-border. Also, um, in the old days, I think old days is pre-pandemic, we would have our providers check that their coverage included telehealth because back then you'd have to get a telehealth rider. But since the pandemic, most malpractice coverage insurance policies that I've seen cover telehealth, but that's also something that you should check that it covers telehealth. If you work for a healthcare facility or organization, usually there's a blanket policy for its employees. Just make sure the blanket policy covers services provided by telehealth. And then also the other thing is states have statutes on consent requirements for telehealth sometimes. So when you're looking at the telehealth laws, also look up whether there's consent requirements, what's needed. Can you do an electronic consent? Do they have to fax your consent? Do they have to mail you a consent? Uh, do they have to sign a consent? Can they do a verbal consent? So there's some consent issues that you need to check when you do telehealth. Next slide. Coverage and reimbursement. Next slide. So I'm just going to tell you right out, this is a very complicated topic. And we are already planning to do a separate webinar just to talk about coverage and reimbursement because so many people asked about it. And we wanted to make sure that we could do it. Um, so one of the things that when I'm doing telegenetics training and telehealth training is that if you're not getting reimbursed for your services in person, it's very unlikely that the third-party payer is going to reimburse you for a telehealth consult. Unless somehow they're an organization that believes that telehealth consults are cost saving. And at that time, they use that as an incentive for you to not see people in person and do telehealth. Federal, state, and private insurers telehealth coverage and reimbursement policies vary and change. You know that from your in-person visits. We know that from telehealth. During the pandemic, sometimes we would be doing a training session and basically telling the people by the time we finish this session, the policy could have changed. That's how quickly policies were changing during the pandemic. Luckily now things have settled down, but things are still changing. When you're billing too, some third-party billers are very stringent about adding the modifier to your billing code that indicates it's a telehealth session. So make sure you work with your billing department and the third-party payers on knowing whether or not you need a modifier to put on your billing code. Next slide. So, most state Medicaid programs cover your dietitian services when the services are determined as medically necessary through the program's policies, how you determine it's medically necessary. Luckily, most of the people that we see do have medically necessary services that you provide. However, because of the current federal policy and budget changes to Medicaid, we are monitoring how those changes will affect coverage and what's determined medically necessary and who is covered under Medicaid. So right now, things are in a gray area until we can figure out what's going on at the federal level because Medicaid, although administered at the state level, is partially funded by the federal government. I don't think many of you work with Medicare patients. That is, Medicare is fully regulated by the federal government, and we also keep track of Medicare coverage decisions. And there are some things happening that some decisions with that are ending soon that we're dealing with right now. So if anyone takes care of Medicare patients, stay tuned to our TRC channels to see what will change and what they're keeping. Next slide. So reimbursement. The other thing about this is check and see if you can get additional reimbursements. Some third-party payers pay facility fees. Some pay at both originating and distant sites. Medi-Cal in California does this. Some third-party payers pay for transmission fees. Again, Medi-Cal pays for transmission fees. Not a lot, but a little bit. And then some third-party payers, this is where you run into problems when there's a provider at the originating site, like a nurse or a medical assistant or even a doctor who's actually presenting the patient, doing a physical exam. Payment at that originating site has always been difficult. We keep advocating for it because you do need sometimes a provider at the originating site to help the patient, especially if you need some physical exam. And then, as I tell every healthcare provider, if you can do a contract for service with organizations to provide services and they take care of the billing, that is always the best way of getting paid for your services. Next slide. Telehealth resources. Next slide. So, what we have, what we created during the pandemic, because we couldn't do the training that we were doing, is we did a best practices for providers video. Now, you'd be surprised how many best practices that there are. One of our trainers from the Southwest Telehealth Resource Center, she used to work for setting up stages and things like that for Up With People. So she used to travel with this group called Up With People. And she says her job now doing telehealth training is very much like that because it's lights, camera, action. So practicing with your video camera, your webcam, to see where it looks like that you are looking at the person eye to eye. So whether you have to put something underneath your laptop so you're not like looking down at your patients because when she always says like scary movies have monsters that hover above you, so you look scary. So if you're working with children, especially, you don't want to be this big scary monster above them. So you want to raise your laptop or your web or lower your webcam so that you're doing eye to eye. You also don't want to be like diminutive, like really hunched underneath your camera so that it looks awkward for the patient. And I know we had to figure out for different people because everyone has different heights when they're sitting, where the best location would be to get that eye to eye with the camera. Also, I know that some people don't like to wear any makeup, which is fine. But when you do have these really high def cameras now, if you have shininess in your face, a little powder helps things from reflecting. It really is like someone says like being a newscaster, I guess. You have to try to reduce the shine in your face or wear makeup. I know that my staff once had asked me if I would pay for their high definition foundation because supposedly that makes your skin look flawless. And I said, I don't think I can justify paying for your high definition expensive foundation to do telehealth. But consider those kind of things. Distracting things are if you like to wear dangly, noisy earrings that when you shake your head or move your head, they make sounds and stuff. That's distracting for your patients on the other end. So, and then also, look at the type of outfit that you're wearing because different bright colors can come across on the camera as really jarring. So looking to see like what's going on. Also, what is behind you right now? I am in Canada at my mom's house, so my background is not what I usually use when I do a telehealth appointment. So seeing if you want to make a formal background for your telehealth platform, whether you can put up your medical center logo, things like that. Um, I have a door behind me right now. Having a door behind you when you're doing a telehealth visit that they can tell is a door, um, makes patients concerned about who's going to come through the door. So it's nice if you can block out the door. So some people have a screen that they put up to block the door so that they don't um, they don't worry the patient that someone is going to walk in the door. So that's just some of the best practices. There's lots and lots of best practices, and we'll probably do a webinar just on best practices. Now, as I said, families are not used to getting telehealth visits in their home. So we developed a video during the pandemic, which we trans converted. So not only language, but we changed the actual skin color, the atmosphere, the environment. The best sample of that is if you go to the Samoan trans converted um, what to expect from a telehealth visit video, you can see that we worked with one of our providers from American Samoa to make the home look more like it would look like in Samoa and have the clothes look more like people, what the clothing would be. The women like to wear flower in their hair and things like that. So that is one of the best trans converted ones because that was one of our providers we worked with. But this video that we have um, helps families understand how to prepare for a telehealth visit. You know, write down your questions, write down your medications, write down, you know, whatever is going on. Get rid of distractions. Don't have children running around. Don't have your pets running around. Be in a quiet place. We have many patients that want to do their sessions while um, they're on a beach, on a beach park. Our California patients like to be driving because it's a good use of time. I'm behind the wheel of my car while I'm doing my session. It's like, no, that's not really. We've had people who have been grocery shopping and want to do their telehealth session while they're grocery shopping, which is not very conducive to maybe for you as a dietitian, you might want to grocery shop with them, but for most of our telehealth sessions, we're not doing anything to do with their nutrition, so we don't want to grocery shop with them in the public place. Next slide. So that is the 10,000 foot level of telehealth for hopefully some of your practices, if not all of your practices. I hope that we have been able to scratch the surface for you of how telehealth can be beneficial and also how we can help you be a better telehealth provider for your patients. I don't know if we have any questions.
Yeah, we don't have any questions yet in the Q&A, but for folks who do have questions, please submit that using the Q&A function located at the bottom of your screen. I'll give you a couple minutes to do that while I highlight our next webinar in the series. We will be Southeast Telehealth Resource Center will be hosting the next webinar on Thursday, September 11th. We have rescheduled that from our usual third Thursday schedule due to a scheduling conflict. But that webinar will be on transforming high-risk OB care with telemedicine. Event information is located at www.telehealthresourcecenter.org/events. We also have a monthly newsletter that goes out on the fourth Wednesday of every month with additional information on our webinar series, as well as TRC regional conferences and events. And we do ask that you take a few short minutes to complete the survey that will pop up at the conclusion of this webinar, as your feedback is very valuable to us, and we use that feedback to create future webinars in this series. All right, I do not see any questions in the Q&A, but if you do have questions in the future, you can always reach out to us at telehealthresourcecenter.org through our Contact Us page, and we will make sure to route that to the appropriate telehealth resource center. Sylvia, anything to add?
I just want to say hi to Ronnie.
All right. Awesome. Well, thank you so much again to the Pacific Basin Telehealth Resource Center for hosting today's webinar, and to you, Sylvia, for your presentation.
Oh, there's
Have a
a
great, oh, actually,
question.
wait,
Oh,
I think
thank
I
you.
did.
Ronnie said thank you.
Oh, thank you. Awesome. Have a great day, everyone.
Thank you.